Good morning, everybody, and welcome back to Sunday Morning with Mike. My name is Peter Walsh. This is St. Mark's Episcopal Church in New Canaan, Connecticut. Mike, as so many of you know, is the Emergency Management Director for the town of New Canaan. We welcome those of you who are new, and we welcome those of you who are 10 weeks into this. And as is our custom, let us begin with prayer. And as I always say, I'm going to pray from my tradition. You pray from yours, and if you have no mixing of and matrix of God in your life, how about sending your energies to those in need? Let us pray. Keep watch, dear Lord, with those who work or watch or weep this morning. Give your angels charge over those who sleep. Tend the sick, Lord Christ. Give rest to the weary. Bless the dying. Soothe the suffering. Pity the afflicted. Shield the joyous. And all for your love's sake. Amen. So Mike, as I'm praying that prayer this morning, all I can think of is maybe I should be praying for golfers, that they have a good day on the links, and those who want to go cruise the beaches, even as the police in the town of Fairfield have drones up there above them, zinging along to make sure they're keeping their social distancing. It's an unbelievably beautiful day out there. People are walking their dogs. They're walking down Elm Street, some with masks, some without masks. What's going on?
Well, it is a beautiful day. It's nice to be back with you. I hope people can enjoy the day and be outside, and also be mindful that there are those who are still vulnerable, and do what they can. I've said this 1,000 times. Our jobs are not that complicated. Wash your hands, wear a mask, and social distance when you're able to. And this should really be a kind of easy, path for the next couple months.
Yeah. So let's talk about the path so far. We're going to come to testing in a little while. We're going to talk about the elders of our community and how they're reacting to everything. But you are working with the elders of our community, as they use an older term for how we consider our town leaders. Not saying that they're all elders. You're working with them. And the town has been, in some sense, opened up, as they say in state language, for the past week. When you and Kevin Moynihan and Jen and Tiger Man all get together, how do you think that's going?
So certainly there's a learning curve. I think the restaurants, are doing a great job trying to bring people back and make it inviting. I think Tiger and the team did a great job making the streets safe. But there's, for every action you take, there's a reaction that you got to judge and gauge whether or not it's working the way you wanted it to or intended it to. So we set up a lot of barricades to make more space available for outside dining.
Right.
The problem with that is you also limit curbside pickup at the same time. So It's a balancing act, and I think the most important thing we can do as a community is be in good communication with our restaurants and our owners of our businesses to make sure we're not negatively impacting them in a way we didn't envision. So the hope is that people come out and start to enjoy why we all live here again, which is the downtown and the people, but to do it in a smart and safe way.
Well, there's when the pandemic first hit, there was an incredible anxiety about what to do, how to stay home, not to catch the dreaded disease. And now there's a new anxiety in play, which is some are saying, I want to get out, I'm going to that restaurant. And others are saying, I don't know what to do. And others are saying, my gosh, I'm staying home. I would say that our community all communities are certainly divided along these lines. And I heard at first the governor was a little disappointed that more people were not participating in the reopening as it came that first Wednesday, a week ago.
I think it's safe to assume that many people think we're not moving fast enough. Many people think we're moving too quickly. There's no magic science as to how we do this. The goal has always been it was never to prevent 100% of the population from getting exposed to the virus.
Right.
So we have to keep that in the back of our minds. People will get sick. The goal is to keep the number of people seeking medical attention at the same time below the threshold for what they can handle in the hospitals. So I suspect we're going to see more infections as we relax our rules, which is okay. And I think I've said this before, but this is about individual tolerance for risk.
Yeah.
Right? So it really depends on what you're willing to balance in terms of your own personal health and that of the community. If you are okay and want to go out shopping, then you by all means go out and go shopping. That's there and available for you. We put rules in place to try to make it as safe as possible. And we try to reinforce those rules all the time. But remember, those are voluntary rules. So
right.
I think the important thing is if you're not comfortable going out and exposing yourself to additional risk, then you should be staying home and taking care of yourself, and that's perfectly fine as well. And the challenge is to not try to enforce one person's view on someone else. So we see a lot of complaints still from those who don't think it's safe to go out, complaining about those who are going out. And we see complaints from those who are going out and choosing not to wear a mask, getting harassed by those who telling them they should wear a mask. So it's tough, and it's not just New Canaan, it's everywhere. We're seeing it on a national level, unfortunately. And hopefully it stays peaceful and it stays calm, but people just need to be sensitive to the fact that everyone's got a different level of risk they want to take, and that's okay.
Yeah. Well, I tell you, crazy times to be a police officer in heightened emotional time and stress for people, and a certain amount of ambiguity.
So there's certainly today's a very tough day in this country, and well, for some justifiable reasons, I get it. It's just tough when you see a lot of the pushback that law enforcement's getting. We have a great relationship with our police in our town, which we're very fortunate to have. But that doesn't mean that they're not getting. I get emails and complaints that someone, bike officer's not wearing a mask on a bike, and they want to hold that person out to be the poster child for not practicing what we're preaching. And the truth of the matter is, I'm asking the public to really trust that the police department knows what their mission is and how they can best provide that safety for us. And if you're on a bike for 6, 7, 8 hours, you're not going to be wearing a mask all the time. And the department's well-trained. They have been at the forefront. All of our public safety departments have been at the forefront of keeping all of us safe. And they've taken this seriously. They kept themselves safe. They kept people safe. They're not going to relax and make mistakes now, and they shouldn't. And if they do, there's continued training we will do, but just give people the benefit of the doubt. And people need to recognize that different jobs call for different functions. And again, all the equipment's available. If people should be wearing a mask, they will be wearing a mask.
Yeah. So, as you know, we, as a community, as we approached this, a great concern for those in our community that have underlying conditions, and for the elders of our community who seem to be more vulnerable to this. And so put into place some ideas, but the elders of our community didn't get to be the elders of our community by not dealing with all kinds of difficulty. And so when we tell them what to do, apparently you're getting some pushback. I wonder if you might say a word about that.
Sure, and it's not overwhelming. It's certainly, there's a few people. I think in the last message I put out, I tried to explain the whole testing program we put in place in town and the purpose of it, and that it was not meant to draw people that would otherwise want to be kept safe at home out to come get tested, for obvious reasons we can talk about. I think I made a comment that I wasn't doing this to offend anybody, and then I got emails back saying I specifically offended people. And I made a point of calling each one of those people and having the discussion with them. And I think the overall theme at the very high level is that risk tolerance that you have is yours to make and make the decisions you want. And we're here to support you either way. But if you haven't been made aware, you should be aware that this virus has a material impact on that class of citizens, whether it's by age or by pre-existing condition. The outcomes are pretty bad. So we just want to continue to reinforce that. And again, all we can do as a society is to make tools available to support them in the safest way possible. Some take us up on that offer. The 450 volunteers that we have that are delivering groceries still, because it's still important, that's the best we can do. Whether or not someone takes us up on that is up to them. If they choose not to, that's also okay. The important theme of testing is anybody that wants to get tested in town, regardless of age or pre-existing condition, is more than welcome to come get tested. I just didn't want it to be an invitation to bring people out of their homes if they need to be at the testing site. And I'll tell you something else. I've gotten calls from physicians in town who have asked me the same question. I'm getting asked by my patients, should I go get tested? And they're 91 years old. They've got emphysema or chronic lung disease, and should they go get tested? And I'm like, what do you think? And we have this discussion. It turns out that they're all on the same page. But it's a message that needs to get out that if you have pre-existing conditions that tend to fare poorly with this virus, you should not be leaving your house just to get tested. I'll tell you something else about testing. The purpose of the testing, and thus far we've done about 1,000 people. And we've got scheduled through the 12th another 1,000 people or so to get tested. So we can have some pretty good data samples of between 5 and 10% of our population. And the antibody testing is still yielding low results in terms of antibodies that if we knew for certain would provide some level of immunity for some period of time, which we don't know, it's a low number of people in town, which doesn't surprise me now given what we've seen with our first responders. The PCR testing, the diagnostic component of this, is really what we're after. And the reason is because as we re-engage the community, we know that if somebody is asymptomatically spreading the virus, it will spread very rapidly, and we'll have no way of catching it until someone else gets sick and we backtrack the couple of days to the week that someone's been in contact with them. So by testing on a diagnostic basis regularly, our goal, very much different than what we did initially where we're testing only symptomatic people. Mm-hmm. We're testing purely asymptomatic people to see if we can identify somebody who has got active live virus and does not know they have it. And that's the goal of this. So let's just walk through the decision making for someone who's in their 80s or 90s and has pre-existing conditions. If it turns out that you are obviously asymptomatic by virtue of the fact that you haven't gone to a doctor and gotten tested yet, so if you're showing up to our test site and it determines that you have 4 outcomes, right? You've got positive and negative for the antibodies and positive and negative for the PCR testing. Under all those circumstances, all 4, the advice to the senior who's over 60 or with pre-existing condition is to isolate at home and stay home and be safe. Nothing changes. If you're PCR positive and asymptomatic, you talk to your doctor who will tell you to stay home. If you're PCR negative, you're still at risk, so stay at home. If you have antibodies, we don't know if it's going to provide any immunity, you stay home. And if you have no antibodies, you're going to stay home. So as much as I love data and we want to collect as much data as we can for our community, the data in that population that is at risk doesn't give us anything more than we would have elsewhere. So I don't gain a whole lot in terms of data, and all we're doing is bringing you out. Now the question comes up about how much risk do we actually have at our test site? And I didn't mean to imply that this is a very risky endeavor. It's not. We've cleaned Lapham Community Center thoroughly. We've got Stanford Hospital, who is remarkable in terms of their efficiency and their professionalism in terms of wearing PPE and making sure everybody's safe. They and our residents are safe. So I think the risk is incredibly remote. But it's probably no more, it's less than it would be going to the grocery store, but it's certainly more than staying home. So the question is taking that risk worth getting results that mean nothing different for you if you test positive or negative? So I don't know what the real, if it's curiosity, again, everyone's got a right to come out and get tested, but the curiosity is not really my concern. Our concern is to identify asymptomatic spreaders early, because that's the only way we can keep our community open. If we decide just to close our eyes and just wait till someone gets sick, it'll be in our community like it was before, and we can't do much about it other than shut things down. So our goal is to really identify them early on. Thus far, we have not caught anybody that's PCR positive that has got active live virus, which is good news, but it's also not surprising. You mentioned we opened up on the 20th in earnest, so it's another couple weeks before we start to see what could possibly happen. Keep in mind also that it's not just New Canaan that's involved here. People come from all over the country into New Canaan for good reasons, and they're going to be at our restaurants and our stores and walking in our parks, and that's okay, but we need to identify kind of whenever we can, as fast as we can, who's asymptomatically spreading the virus. And that's the whole goal of this. So that probably opens up a whole lot more questions than it answers. I'm sure I'm going to get more criticism. Why don't you throw some questions out on testing if you don't mind, Jill?
Yeah, thank you. I was going to say there are questions. One is, will you test employees who live in town or who work in town but don't live there? And also, what is the proper interval of time between tests?
So we already have opened this up to non-residents. So if you think about our first responders, town employees, most do not live in New Canaan. We open up to all of our service workers also. So we work with the Chamber of Commerce to get all of our restaurant service people, our frontline grocery store people, everyone that wants to get tested that works in town, that we'll be in contact with, should all get tested, and we recommend they get tested. Those that are uninsured, we've also made accommodations, even though they don't live in town, to make sure they can get tested and not have to pay for it out of pocket. So we've done everything we can to ensure that we get everybody that needs to get tested access to a test. The question about how often should someone get tested, it's a very good question, because this is not, the antibody test is kind of interesting, but the PCR test is one snapshot in time at that given moment, which doesn't mean the second I call you through results that you can walk outside and get exposed and be positive shortly thereafter. So the goal of this testing is to have people tested on a regular basis, and I think for us to think about this on the continuum of getting to a vaccine, if it takes inside of a year or 2 or 3 years to get to a vaccine, we should, in our minds, get comfortable with the fact that we're going to be testing on a regular basis throughout the entire process. And I think people coming back to get tested is a great idea, but let's just talk about the math of this for a second. And testing is proving very complicated. And there's a reason why we're probably the only community in Connecticut doing what we're doing, because this is not for the faint at heart in terms of logistics, in terms of the data. I can spend 2 hours talking about the complications we've had with the sign-up genius and stuff like that. There's limitations to everything, and we've blown through all the preset limits that these services provide. But if we have 20,000 people in town and we can test 160 a day, it's going to take us a long time to get to everybody if they want to get tested. So what we're asking right now is, and we're not limiting it to people re-signing up for more testing, but because we're only opening up a couple days at a time, and I can talk to you about why we're doing that, it makes no sense to get tested today and then come back next Monday and get tested. So, my guess is every month you should consider getting tested, and if we can get our capacity up beyond 160, then we probably can handle repeat testing while we're doing new testing. But we're limited to 160. We're limited both in staffing at Stanford Hospital, and we're also limited in terms of how many people the forms can handle. So people that have, and I'll apologize as many times as necessary, but the forms that we're using to make this easier and online, to make it quicker when you get on site, so you just walk through the site and you don't have to fill anything out. It turns out that those forms, the maximum number of forms you can fill out online fillable is 1,000. And when we opened up the first 200, 300 tests, we filled up 1,000 forms, and I couldn't figure out why that happened so quickly. It's because people didn't wait for an appointment. They actually just filled out the forms, waiting to be ahead of the game, which is great. So the next time I open up dates, they can sign up for the dates. The problem is they maxed out the form, so those who had an appointment could not fill out the form. Okay, so we learned Sign Up Genius only has a certain number of slots available, so I couldn't open up new dates until I closed out the old dates. So I actually had to take the old dates off the system to open up new dates. So these are all things that no one cares about, but it's the things that we do internally so that when you show up to get tested, you don't have a 15-minute form to fill out, and we get more people through the test sites. So we're working through this. The Board of Education, the schools, Brian's been great in terms of helping us with new technologies that we can use, because they obviously send data out to 5,000, 6,000, 7,000 people to get feedback. So we're working to improve it. The test site the schedule is complete until the 12th of June. So we really have until the 15th of June to work on new technology, and we'll roll things out. When I sent out the message for the last 2 dates to sign up, it was a new embedded link for the forms. But if you clicked on the old link, you would tell me that you still couldn't sign up. So again, bear with us, read the full email, use the links that we're sending out. If you think I've done this before, you're mistaken. We're learning as we do it, which is never healthy, but we're trying to make it as efficient as possible. And nobody, to the best of my ability, has been able to offer comprehensive PCR and diagnostic and antibody testing at the exact same time. So we're trying to be ahead of the curve. I suspect the rest of society will get there in a month or two and start offering this up as well. And our goal is to be a little bit ahead and perfect this by the time it's really necessary.
Wow, so much. This is like an iceberg. People might see 160, but underneath it, there's a whole
Yes.
operation. And maybe Sign Up Genius might want to be renamed Sign Up Real Mart.
Right.
Maybe not Genius.
There are limitations that we didn't know
There's
existed.
limitations to everything.
Yeah.
Jill?
Yeah. So you've begun to touch on this. So this is a question from someone who lives in Wilton. Why is this testing only happening in New Canaan? Is it a pilot type of testing? This person's physician has said that there isn't a test out there for antibodies that's proving to be effective.
So that's not accurate. I think early on that was accurate, and I think as we talked about before, we set up to be able to do this testing, and we're really just waiting on the science to catch up to have a test that was efficient, that actually didn't have the false positives that you were seeing elsewhere. A lot of other communities have confused motion with progress and put antibody testing into place, New York City being one of them, where they tested 5,500 people, and they did a capillary test, and finger prick tests are proving to have 30% false positives, and doesn't really give you any data that's worthwhile. The testing that we're doing in town has the 99% accuracy and specificity that are required for both the PCR and the antibody testing. It's obviously a full blood draw, so it's a little bit more invasive, but that's what you need to get the right results. Doesn't mean we'll use this technique forever, because as science improves, we'll get better testing. So there's a saliva test that companies are working on right now that, believe me, if they could prove that to be as efficient and as specific for testing for SARS-CoV-2, we will switch to that and make it as painless as possible. But that's not the case. As far as the PCR testing, both tests were using Roche and Abbott Labs technology, but we're actually using them in ways that initially weren't being used by New Canaan and by others. So the PCR testing that we're doing, we used the drive-through testing in town, and we were taking the nasal swab, putting it into a test medium or a transport medium, and sending it on ice to California to be tested by LabCorp or Quest. And what we've learned is that the technology and the equipment isn't the problem, but the transport medium led to a lot of false positives. So what we're doing in New Canaan is we're not using any transport mediums. We're actually taking the swabs, which have a shelf life now, and driving them to Stanford Hospital lab immediately, so that every hour we're transporting the swabs, so that we can avoid using the medium, which is what was causing all the false positives. So again, we're learning this as we go, and if there's improvements, we'll improve on it. As far as why other communities are not doing it, I can only tell you it is a lot of work. So doing nothing is far easier than doing this, I can assure you of that. We've made it a mission in New Canaan, if we're going to open up our stores and our downtown and our parks, to do it as safe as possible. And clearly the safest thing to do would be to keep everything shut down, but that's not realistic, so we know that. So the best we can do is really just try to make it as safe as possible. And to say you have contact tracing without doing testing is a huge disconnect that doesn't make any sense to me. So do I think other towns will get there? Yes. As we perfect this, we'll share with other towns what we're doing. But again, we've got a partnership with Stanford Hospital that is required to get something like this done. Just having someone take swabs and send them on ice to another lab is not the solution. So no one in the state is doing this. And again, it's because it's a lot of work.
Yeah, so this testing, would you say that people who don't live or work in New Canaan can find ways to get the same testing?
I can't answer the question.
Yeah.
So I don't know if you're living in other communities, if you can go into, you can go to CVS, so, the state's doing testing in New Haven. The state's doing testing for first responders in New Haven. We're going to have our first responders tested here as often as they need to be tested. I don't know what other communities are doing, to be honest with you. I'm focusing solely on what we're doing here in New Canaan, and that's a full-time job.
Quite sure.
I suspect as we perfect this, and again, it's not unlike what we've done in the past in New Canaan. So years ago, we had storms that came, and we decided, with the help of some of our high school students, we created this online mapping system to show where downed trees and wires were in town. And I think the first thing we did after we perfected that system in town is I sent it out to all 14 towns in Region 1 in the state to share with everybody else, because it was a free technology. You can use Facebook and Google Maps, and you can pretty much do the same technology. So once we perfected it, we wrote a direction guide on how to do it, and we sent it to the neighboring towns, and they adopted it, or they didn't. This will be something similar. So I think Jen and Stanford Hospital, we're working around the clock to make this as efficient as we can. And once it's there, I would imagine other hospitals and other communities will partner up to do something similar.
Yeah. So just a straightforward logistics question. Can someone sign up for just one of the tests versus both?
No. How about that? You never get a yes or no question answer out of me.
That might be the record for the
That's
shortest
10 weeks.
answer you've ever given us.
That's the first time there's been a one-word
answer is
answer
no.
in 10 weeks.
All right.
So, sign up genius, sign up smart guy or smart gal, people contacting their doctor or getting on the Gov website to do this. Just literally the logistics one more time for everybody.
How do you get tested?
How you get tested. I know you do it over the phone, but just tell us one more time just the nuts and bolts of this.
So the sign up for Blackboard Connect is on the town's website. If you go to newcanaan.info and click on COVID-19, it's the second or third link down. You'll see how to sign up for the town's out-call system. That's how this starts. Yep. So it's an email-based system. We need your email address. And then what I've done is, it's very hard to read a link on a phone. So I've sent the email out at 7 o'clock with the embedded link in it that you click on to sign up for that series of testing that we're opening up. And I'll just give everyone the secret. It's coming out at 7 o'clock, depending upon when Blackboard Connect can get my message out. So there's certainly times now where it goes out at 7 o'clock on the dot. And for those of you who I've woken up at 2 o'clock in the morning with a delayed message, I apologize. I didn't put it out at 2 o'clock in the morning. The systems got tied up, and if all the communities are doing messaging at the same time, the bandwidth is such that it goes when it goes, and I can't stop it. So that's happened, and I apologize. But the goal is to get this out at 7 o'clock until we can get a new system where I can open up a week at a time, which will stop the frustration. What's really frustrating people right now, I think, is that I'm opening up 2 days at a time. And when you open up 2 days, those slots fill up in like 15 minutes. And I think the last 2 days, because it was on a Friday at 7 o'clock, I watched it, and it took 45 minutes to fill up the 2 days. Again, it's not as if it's filling up in 30 seconds. So people do have time, but they're out having dinner. They can't get back in time. It's unfortunate. So once we get a new technology in place, the hope is to open up 5 days. And if I open up 5 days, everybody that wants an appointment in that hour or 2 hours they're signing up should be able to get an appointment. So at 7 o'clock they open up, click on the links, get your appointment first. And then as soon as you get your appointment, then go back to the email, click on the link to fill out the requisition form. We made it a survey, so it's really pretty simple. So you only get the questions that you need. If you answer yes or no, it gives you the next question. It should take, on average, it's taking 4 minutes to fill out the form. Hit submit, and it should come to us, and we should be all set. There's nothing else you need to do. You'll get an email telling you that your appointment's been confirmed, you're ready to go. And it really has been that simple for those who get in. For everybody else, it's a different story, and we've had a lot of discussions via email, via text, being phone calls about why you're not able to get in. And again, it's because the demand is so high.
Thank you. Okay, slight gear shift here. So you guys and gals are all working hard. You're embedded in a system. You're worrying about and working on New Canaan and all the flows around New Canaan. You've been working on the hospital systems around us because we're part of a network there. You sent me an email the other day forwarding something to me, and it said at the bottom of the email that something about emergency management coordinator, Bridgeport, Connecticut. What is the system that you're plugged into? You have a whole big system?
We do. So on the national level, FEMA manages emergency management for the country, and there's different regions of FEMA leadership and oversight. I would say, by and large, FEMA has very little active involvement in what we do, other than reimbursement. So most of what we do from the national level, the involvement really is just submitting paperwork for declarations so we get reimbursement as a community. When you get to the state level, the state does have a robust emergency management operation. There are 5 regions in Connecticut. We're Region 1. There are 14 towns that comprise Region 1. We have 1 regional coordinator. We meet at the State Police Troop G once a month. Now we do it electronically from our own homes, but we meet regularly with our regional coordinator as well as all of our 14 counterparts that I work with every day. For all the towns. So we have an open dialogue. On top of that, there are emergency support functions that, law enforcement, fire, health, hospitals, that all have working groups that have been working for years together to coordinate policy and response. So in this case, it's unique in that the entire world is handling this exactly the same time. Normally it's a region with a storm that handles something. And if that were the case, we would have enormous support coming from other regions to come support us locally. You don't see that. Most of our hurricanes, you don't see it either because it took out the entire state or a good portion of the state. But in this instance, we don't have the luxury of having our neighbors from other towns come to help us because they're dealing with their own problems at the same time. So there is a robust state infrastructure. I've said this before and I will say it again. New Canaan is largely self-sufficient. If you go back the 9 years I've been doing this in New Canaan, we've really never relied on the state for much, other than the only times we need outside support from our town is when it involves power lines, because Eversource is the sole operator on their power lines. So in this case, we really have not needed any support from the state. In fact, I think we're probably ahead of where the state's able to function because we just are more nimble and more resourceful than the state's able to be.
Interesting. Thank you. Jill, do you want my attention? And so, Mike, as part of that, you have this infrastructure here, and then you have the governor's office. So those of us out in TV land, we're all listening to you. We're listening to things the governor is putting out. We're listening to the things our country is putting out. I wonder if you might say something about the governor's office and how that infrastructure works and the dialogue that's happening. The governor receives kudos and condemnation. He has a system in place that satisfies some, doesn't satisfy others. It's easy to make policy. It's nearly impossible to implement it. What about all of that and the dictates that come from there?
Sure. So at the onset, I think I'm and Kevin, we're all exposed to the exact same, praise and, one hand people think you're doing a great job, the other hand people think you're doing a horrible job. I think that's just typical of this environment, and that's not. Yes. I don't view it personally. I don't take it personally. I don't think the governor should take it personally. I think it is just a force of nature where we are right now. We're actually in a point where, again, half people think we're moving too fast, half too slow, and that just creates anxiety for everybody. The governor has a unique ability to rely on public opinion for some of the decision making. And I don't want to speak to why he does that. It just may be his nature, and there's certainly nothing wrong with it if it works for him. I think in town we're very, very different, and our decision making is based on different criteria than I think the state's making their decision making. So what I mean by that is we've seen decisions that were made over the last couple months where they were based on science and they were based on practical implications for doing something differently, and then based on public outcry, their decision was reversed almost immediately. I think the most important thing a leader can do today is to say that we are also learning at the same time. None of this has been known before. We're going to make mistakes, but if we're going to err on the side of making a mistake, let us please err on the side of being cautious and not being reckless. And I think communication has to be consistent. So if you're going to say what you mean and mean what you say, and follow through and have your actions actually demonstrate what you're actually saying. So if there's any criticism from the state, from my perspective, is that we are kind of changing course midstream, and it's very hard for people to plan. You look at the hairdressers, for example, and it's not that it's not important. I think people want to look as good as they can, and they feel good when they look good. But to make a decision with whatever basis they were making the decision on to open them on a certain date, and then immediately change course because they got feedback from somebody that the loudest voice said, "Don't open, we don't want them open." They closed them, and they got more feedback. It's just inviting more hassle than they need. We're going to have the same experience, if people aren't aware of this yet, on our camps in town, our town-based camps. So we've made a decision, and it's Kevin Moynihan has to bear the brunt of a lot of criticism on the camp decision, but he had unanimous support from all of us in terms of what we were doing with our camps. And because of the dynamic of the camps and the restrictions on the camps, it was determined that our town-based camps would not open this summer. And I've got 5 kids, right? And I understand what camp means to the household. I get it. But it wasn't something that could be done safely and efficiently. And people constantly go back to I should say I give Kevin a lot of credit for making a very tough decision. The easy decisions are just that, they're easy. The hard ones are kind of tough, and all I can tell you is that we are thoughtful about it. It will not please everybody. We know that in advance, but that's okay also. If you think about, it's kind of amazing to me that we get this enormous, people are scientists when it suits them, and they're not scientists when it doesn't suit them. So we made this decision about camps, and all of a sudden we get, 1 million emails coming in. And when I mean 1 million, I mean 6. It feels like a lot, but it's really not that many. But it's the CDC says you can do camp this way. And I just want to remind people that the CDC is kind of not the benchmark you want to be following all the time. The CDC told us you can wear a surgical mask in lieu of an N95 if you're a frontline healthcare worker because they didn't have N95s. That was not smart. And in New Canaan, we never went that route because our health of our first responders was of utmost importance to us. So we made sure we provided them with what they needed. But if you followed the CDC guidance throughout all this, you would have made some tactical mistakes along the way and paid the price for it. So we're trying to be mindful. We can't be less strict than the federal or state government's going to be, but we can be more strict. And I think we've chosen to do that in areas where it makes a lot of sense. So again, when you don't like what the CDC says, I never hear from you. When you do like the CDC says, you send it to us. We do watch what the federal and state guidance is, and we try to marry our practices to what they're telling us. And again, this affects you. I sent you an email, I don't know what day it was, yesterday or today. Was it yesterday?
Yesterday, yeah.
The state just on a whim, decided they can, you can change the number of people that are gathering, both inside and outside. So now your indoor church gatherings are 25% of your fire marshal's capacity, up to 100 people. There was no warning that was coming. There was no indication that was coming. It was just a decision that was made, and no one knows what it was based on. But that's going to, every time the governor makes a decision, it forces all of us to adapt and kind of react to that kind of decision making.
Well, I'll tell you, that decision had people of color here rippled through our Friday afternoon conversation of clergy in town. So no doubt that all these decisions do have ripple effects, domino effects.
Well, let me tell you the good news, okay? There's really good news in all this. So we're not just robots, right? We're not just reacting to what a rule is and saying that's the rule we got to follow, right? So obviously the speed limit is 35. We can't go above 35, but we can go 25. So when I sent the email not just to you, but to others as well, and the response I got back from you and others was, well, what do you think makes sense? Like, what should we do? Not hey, we can do it. We're having 99 people in our church tomorrow, today for services. But what do you think makes sense? And I think that kind of investigation and analysis is really smart, and the people of New Canaan are benefiting because of it.
So speaking of these, so we've taken some steps forward. We know it takes, as the virus begins to spread, a few weeks to show symptoms. And there's a lot of conversation about watching for a second wave and things like that as things are relaxing. Are there particular markers or milestones that you're looking for that will be a trigger to say, we need to dial back a little bit?
Yeah, positive Pcr testing in our diagnostic testing that we're doing every day. So if we start to catch asymptomatic people that are positive, we are going to isolate them, and again, it's voluntary, so we hope people will listen, but we will isolate and quarantine any known contacts they've had for the previous few days, whatever's warranted. And then we're going to look to see if it spreads, right? We're going to look to see if we have outbreaks. And the goal here is to contain the outbreak before it becomes an issue. If it becomes, if a church service has 99 people in it and we end up with 35 people testing positive, that's going to give us a moment of pause. But our hope is, again, that we can actually manage this appropriately till we get to a vaccine. We will see data that's going to suggest otherwise. We're going to see data that says hospitals are filling up with non-COVID related healthcare, which is now essential because they put it off for so long. And those beds will be taken by those who need to be there but are non-COVID related. If we lose capacity, we got to monitor the capacity in the healthcare system with the number of infections we're having in town and the outcomes. Without testing, we're simply just closing our eyes and hoping that things work out okay, and if they don't, we'll find out by the back end of this where people are dying and we can't slow it down fast enough. Jill, I don't know when we're going to do this, so make a note. We're going to talk about birthday drive celebrations before I leave today. I want to be the person that actually...
Do it right now. Now.
So I know this is going to be unpopular, which is why I'm going to do it myself and not force others to do it for me. We, as a community, took a step to try to make kindergarten to fourth grade birthdays special in town since they couldn't have birthday parties. Because the governor is now relaxing the regulations and restrictions on having people together, we are going to use June 12th as the last day for drive-by birthday parties or celebrations parades from our first responders. And I want to say that I know if your kid's birthday is on June 13th, you're going to give me a call before I leave here. That's okay. It has to stop at some point because we have to get our kids back into some normalcy, and having, if it's 4 friends or it's 9 friends, whatever the state decides you're allowed to have, just do it safely, socially distance, and wear masks is all we ask. But it's taken a lot of our first responders' time every day. And I give someone credit. Somebody did call me and say, how much fuel is it costing us to send our fire truck and ambulances around town for birthdays? So I think they're fiscally conservative. I like that. But we thought it was worthwhile both for our first responders to get something to do that's positive, but also I've done it a couple times, and to see the look on kids' faces when you drive by has just been a really helpful thing, I think, for the community. So you're hearing it from me first. I know Brian's probably going to put it out to the school community shortly. I know the first responders want it out. June 12th will be the last day of birthday celebrations that we drive by.
I think everybody's going to survive.
Yeah. I have just one question, which I think is on a lot of minds of the seniors who are at home and for whom this has been really difficult. When will New Canaan be considered safe Is it when no one else is dying, when people don't need to quarantine, when there's no cases? When will people feel like they can leave their homes?
So this comes up a lot in my house as well with children. I think we've talked at times about having a discussion about how this is affecting children, maybe having us joined by a psychologist or someone that deals with children regularly. I by no means am an expert, and my 5 kids are a small petri dish of a data sample, but I think it's important for people to know that New Canaan's safe right now. It's safe provided you take some very basic measures. And again, our first responders are probably the perfect model to follow, right? So we've got 220 people that are somewhat positive in town that over the life of this illness, and most of them have been transported to the hospital by an ambulance. That ambulance, police, fire times, and EMS have been exposed to a lot of active virus throughout this entire process, and none of them have gotten sick. Just make sure this is.
I hate to say it's
is
plastic.
it wood?
Plastic.
So yes. So none of them have gotten sick, and very few have been exposed and developed antibodies. And it's unclear if they got it at work or they got it in their private lives at home. So I think, again, New Canaan is safe. There's no reason why you can't go out and enjoy yourselves with limitations and be perfectly safe. If you're going to start going to parties, taking masks off, and non-socially distancing, if there is somebody that's positive in that community, you're going to get sick. Good news also is that we've got capacity at our hospitals, and we are better at treating this than we were 10 weeks ago. So again, you have to balance, telling people it's perfectly safe, because then people go right back to where they were before, December, January, February this year, which is not a place where we can go to. But to not be, to be home paralyzed, thinking that you really can't breathe the outdoor air is unfair also, and it's also not accurate. So it's safe with limitations. Wear a mask, wash your hands, and you should have no problems going about doing what you're allowed to do in town.
Oh, wow. We've come a long way to that statement, and I'm really grateful for that question that came in. So I'm going to finish it up there, because it's so great for us to be able to finish up on something of a positive note. So when I came in, you said, hey, what's with the barbecue sauce?
If that's a new hand sanitizer, I'm out.
Okay, but you're going to be in on this. So this is, we have, St. Mark's Episcopal Church in New Canaan, Connecticut is a place of great mysteries and great joy, and we have a ministry, as we call it in our church, lingua franca, of smoking meats. Okay, we have the Holy Smoker, and we, as the Holy Smoker, have Bell Tower barbecue sauce, nation's #1 Bell Tower barbecue sauce. George Wright, who you know from CERT, is certainly one of the great brewers of this barbecue sauce too, along with a whole team of smokers. And this morning, George sent me a little note on something completely different, and then he noted that, maybe is that me that's suddenly making weird sound? He noted that, hey, what about a little Bell Tower BBQ to say thanks to Mike? And so, Mike, this is from us, from our ministry, to say thank you to you. And I want you to know that I got you 2 bottles, because you got those 5 kids. I have 5 kids, and these animals eat a lot of food. That's what I've discovered when they all come home. God bless you. We just really are grateful to you. We are grateful to your team in town, and we are grateful that we could go, I don't know if it's 10 weeks. I'm saying 10, but I'm not great at math. We've been at this for maybe 10 weeks talking here, and you said New Canaan is safe provided that you do the right stuff. And so that's a great moment for us to say thank you to you and thank you to your team, and God bless you. I know the drama ain't over, and every week brings something new. It's just amazing that every week brings something new, and I look forward to continuing the conversation with you. I know the day will come when we may not continue this conversation, and we may bring somebody else in to sit in Sunday mornings with Mike, your seat. But for now, we're still with you, and we're grateful to everybody who comes and listens to you or stays at home and listens to you, and for the questions that you bring. This has been a great public service and a great good, and we are grateful to you and grateful to everybody for all of that.
Thank you very much.
Yeah, really great. And so for those of you who are members of our world here, today is the Feast of the Pentecost. This is the Holy Spirit, the Spirit that unifies all of humanity together with a great life. And we're grateful to the Spirit that moves in our community and in your life and in your household that unifies us in the great drama that we have before us. Okay, everybody, thanks so much. God bless you. Take care. Have a nice day. See you.